We herein present the preoperative, intraoperative and postoperative urethroskopic findings of buccal mucosa urethroplasty in a patient with a proximal bulbar urethral stricture. The preoperative uretrogram is first demonstrated. We show the urethroskopic findings of the stricture at the time of the visual internal urethrotomy, which was done 1 month prior to the buccal urethroplasty. The extent, depth and degree of bulbous of the spongiofibrosis is demonstrated. The incision has been placed with a Sachs urethrotome. The distance from the verumontanum is shown, which decides how difficult the suturing of the buccal mucosa will be. The prostatic urethra, the trigone, ureteric orifices and the rest of the bladder are normal. The urethroscopic findings during the time of the buccal mucosa urethroplasty is demonstrated next. The cystoscope has been passed through the urethrotomy at the time of the surgery, demonstrating that the stricture segment has been crossed and the proximal normal urethra is seen. The methylene blue stains are the remnants of the dye used to identify the normal urethra. The proximity to the veru is demonstrated. The distal urethra has been shown and the normal mucosa is seen. The latter part of the intraoperative urethroscopy findings show the urethral appearance after the buccal mucosa has been sutured. This urethroscopy was necessary to pass the guide wire to negotiate the Neneton's catheter into the bladder after the repair. The post-operative urethroskopic appearance done 2 months after the urethroplasty shows the appearance of the healed buccal mucosa. The lumen is wide open. The proximal and distal limits of the mucosal anastomosis are satisfactory. Patient had a good post-operative urine flow and did not need any additional procedures. We would like to stress the importance of an accurate urethroscopy for a successful buccal mucosa urethroplasty. We would also like to stress the necessity of accurate suturing and the success of buccal mucosa urethroplasty even in a patient with relatively significant spongiofibrosis. This video satisfies the normal curiosity to view the healing of the buccal mucosa in the urethra.